Hi, I'm Jubi, and we're here at the Chicago BL, the Midwest's largest transgender convention. And here with me right now is Dr. Douglas Ousterhout, who's the developer of facial feminization surgery and a presenter here at the BL.
Thank you, Jubi.
Welcome.
Thank you.
So, how long have you been a presenter here at...
I don't remember what was the first year, but originally it was in Cincinnati where I first went. It seemed like there was a couple of years there, then Pittsburgh, Cincinnati, Detroit, Cincinnati, somewhere southeast of here 1 year, and then sort of went further north, Arlington area. So it's been several years. It's probably, it could be as many as 15 years.
Ah.
Maybe longer.
And so are you from the Midwest? Or?
Yes, I'm from Michigan. And the University of Michigan, contrary to Champaign-Urbana and things like that in Madison. But and I grew up in East Lansing, where Michigan State University is, so I'm a real Midwesterner. But I've been in San Francisco, I've been in California since I finished my training at Stanford University. And
can you talk to us a little bit about your training?
Surely. I didn't know what I wanted to do. I started out as an electrical engineer. But I knew I didn't want to be an electrical engineer, but I didn't know what I wanted to do. So actually I went to dental school before medical school. So I'm a dentist, but as soon as I took my state boards, I walked across the street and started medical school. But you would not want me to be your dentist. That would be a mistake. But I've been practicing plastic surgery since I basically finished my training at Stanford University and then took a, I guess you might say a postdoc or a fellowship with Dr. Paul Tessier, who was the father of craniofacial surgery. In Paris. I came back and started the Center for Craniofacial Anomalies at the University of California, San Francisco Medical School, which I ran for 25 years, taking care of children with all kinds of unusual skull problems, working with a neurosurgeon. So that's the major source of my development prior to doing this.
And how did you go from working with children to working with the transgender community?
Well, one day, one of my colleagues, who unfortunately is now dead, who did gender reassignment surgery, said, I want you to feminize the forehead of a patient of mine. And I had never thought about feminization of the face, of the forehead. And in San Francisco, we have two major skull collections. One of them is in the University of Pacific School of Dentistry, and that's the best one. About 1,000 skulls, and they're sexed. So I studied those skulls and read about 5 books on physical anthropology of the face and realized that boy skulls are different than girl skulls. And that was the beginning. That's been several years ago.
So you talked about physical anthropology. What did you find about the difference between a boy skull and a girl skull?
Prior to the development of more sophisticated measurements in the computer where they could do a lot more mathematical work, a physical anthropologist really had only 3 things that he could identify a skull. It was the forehead, the nose, and the chin. And using those as the differences, a good physical anthropologist was accurate about 78% of the time. Now they really are, they can, with all the measurements they do, they can be almost 100, not quite, with identification of the skull. And the 3 things that are important are the forehead, the nose, and the chin. Males have bossing here that females tend not to have. And if you feel my skull, there's a flat spot here. It's about the size of a dime. That's a typical male thing. Female skull, forehead, is continuously convex in all directions. The takeoff of the nose on a male is at a less of an obtuse angle, not quite as an open angle. Thus, males tend to have a dorsal hump on their nose, like I do. Not all males have that, but that's characteristic. The other thing is the chin. The male chin not only tends to be broad and angular, if you can think of some male movie stars that have these very dramatic chins, but the vertical height from the top of the bottom teeth to the bottom of the bone is 17% greater in the male than it is in the female. Sometimes males have monstrous chins. I mean, they're really big ones. And if you want to have that feminized, these areas, you've got to put them into a female shape and contour.
And so what's involved in putting them into a female shape and contour?
Surgery. There really is no, unfortunately, we don't have a poof of dust that I can sprinkle on you and bingo, it's all done. And so when I first saw that first patient, I came up with 4 operations that I do in the forehead, and I call them my forehead 1, 2, 3, and 4. And with that, I can change, I think, any forehead to basically any shape that we might want. And I've got lots of different things I do to a chin to reduce its vertical height, to bring it forward or set it back or to narrow it depending upon the individual's chin. I do not use implants. Except in very special circumstances. I will in the cheeks sometimes. And then the nose, it's an extensive rhinoplasty, setting it back, particularly if you can visualize if the forehead and nose are basically the same line. It looks like we all have a notch here, but usually we don't. It's usually almost straight down. It looks like we have a notch. So if you set the forehead back, now the forehead is entirely behind the nose. So even if you got a nice nose, we usually have to do something on the nose to make it fit in the appropriate contours to the forehead.
And with each patient, I would imagine there's a slightly different...
And there's a slightly different measurement on everybody, absolutely. One of the measurements for some reason, I don't know why I started doing it, long before I was taking care of transgender patients, was measuring the projection of the forehead and its relationship to the eye. And it turns out that in general, the shortest distance on a male, the projection of the forehead, is greater than the largest distance on the average female. So just doing a little bushy burring down of it a little bit doesn't really put the forehead into a female position. 95% of males have a frontal sinus. The frontal sinus is right here. You have the cheek sinuses that we all know about, and then of course we get these infections in our sinusitis. What's the function of a sinus? As near as we know, the only function of a sinus is to lighten the skull. And if you can visualize you're an animal and you're on all four, and your forehead, your whole head's out in front of you, I suppose any reduction in weight is less work for your neck muscles. With us standing in the vertical position, it's probably not quite so important. But 95% of people, males or females, have a frontal sinus. So if the projection is greater than you want to be, and this bone is only about 1.5 millimeters to 2 millimeters thick on the average person, then if you set it back, you're actually into the frontal sinus. So we do. We take off this bone, we set it back, do all the contouring, and then reposition the bone, wire it back into place so it'll heal just like if you broke your arm. We can't put a plaster cast here, but we use a non-magnetic stainless steel wire. So you're not going to keep you out of a bank or out of an airplane, or more importantly, if you ever had to have an MRI scan and they put you in that magnetic chamber, you're not going to get stuck to the walls when they turn on those heavy magnets.
Oh, yeah, yeah. So is there anything that you want to tell the attendees here about who's a good candidate for facial feminization and who might not be?
I don't think I've ever found a patient that didn't benefit from some degree of surgery. It depends upon the face. I've had a few foreheads that did not need to be feminized. They were great. It's not common, but it happens. Of course, you have to be healthy. You can't operate on a person who is not eligible for any kind of surgery. But we've had patients who have had previous heart attacks. We've had patients who have had strokes, diabetes, gout, any number of medical problems, drug allergies. We can work around those things. Mm-hmm. That's not a problem for us. I think the major issue in this is wanting to be female, and how far do you want to go in being female? And if you really want to pass and never be seen, considered as a male again, I think we have a tremendous amount to offer you. Obviously in some people, having this surgery is not important, and that's fine. But if you really want to be female, I think the things that we talk about, the things that we do, are very, very important. And I think that my patients, some of them are beautiful. Not everybody in the world is beautiful. But I think all of our patients look female. I think that our patients are more attractive as females than they were handsome as males. Mm-hmm. So, and no one has gotten worse, not one. And so I think it's very valuable surgery. It's a commitment. It's surgery. There's a recovery time, but the recovery time is not very long, and the black and blueness goes away, and like all healing, it gets like all surgery, it gets better. And but it's not overnight. It's not a walk-in. It's not outpatient surgery. We do it in the hospital under general anesthesia. But the main thing is, some of this surgery, I think to some people sounds extreme. It is not. It's surgery that is well tolerated by the body. People heal. I think it's, to some people, surgery is scary. I understand that. I totally understand that. You know, no one wants an operation. You want the results. And if we could get by without doing these surgeries, we would do it. But surgery is necessary, and the results are good. And I'd say do your best to just put that aside. You will be fine. You'll do well. Things will look great, and you'll be happy you did it once you're over all this. But, you know, there are other things beside the forehead. There's the chin and the lower jaw that we need to address. And another thing, you know, the thyroid cartilage, we reduce that, the prominent Adam's apple. When you watch me talk, you basically only see my lower lip, my lower teeth. I don't mean my lower lip, you see my lower teeth. In a female, when she opens her mouth and before you smile, you see her upper teeth. And so we reduce the upper lip to give good tooth show. And it's surprising, but it's very important in the overall passing, if you like the word passing, or blending, whatever your word might be. And if you sit in Starbucks having a cup of coffee and you look at the women in there, I'm willing to bet you on far and far the majority, you're going to see their upper teeth when they open their mouth and before they smile. And you're going to see their forehead, you're going to see their jaw, and it's different than the male. And so all these things, we've certainly sort of focused on the forehead, but that's an important area. But the jaw and the chin are such important areas as well. The male chin is quite different than the female chin. And in my mind, it cannot be corrected with an implant. You need to have what I call, what's called in medicine, a sliding genioplasty. It's a big word for a chin modification through surgery. And it's bony surgery, but it's surgery well tolerated, the body heals, and you're done with it. It's permanent. And that's one of the things. All the surgery seems to be permanent. We've seen a lot of patients post-operatively for many years. Most of my patients do not come from San Francisco. They come from literally around the world. So we don't see everybody back again after they leave San Francisco. They might rate and send us a letter saying how much they enjoy the results. We might get some pictures, not always. I'm sure that some people, we don't even know their real name and address, and they disappear in the woodwork. But the surgery goes great, and the results are great, and people really look wonderful.
Well, you mentioned seeing some of your old patients here. Are there any other things that you find really rewarding about being at BL?
Oh, as I said, it's fun being back in the Midwest. Yeah, because we've had a long connection with it. One of the longest connections, of course, is with Julie Johnson. And Julie's such a wonderful person, and I love the gal. And it's so good to see her at these meetings. We don't see her in San Francisco much anymore, but Julie's a great person. So
thanks.
And there's a lot of people like Julie that we see.
Well, I also understand you've written a book.
Yes.
Facial Feminization Surgery. It's available on Amazon.com?
Yes, it is. It was published just about 6 months ago now. It came out right around the 1st of December. And and talks about the individual surgeries, but also there's the various operations, the number I've done, and the publications. I've done a lot of publications in the medical world, but the ones that are related to facial feminization are listed in the book. And this is based on my first 1,100 patients. We're now over 1,200 patients. I think we have quite a large series. I'm sure we have the largest series by a long ways of anybody in the world, and obviously the best results.
And what about BL would you say is special?
Well, it's home for me, getting back to the Midwest. We have a lot of friends. We got a lot of patients from the Midwest. We get to see a lot of our patients here. There's several here at the meeting that we've treated over the years. And it's just it's a fun place to be. You know, it smells different here. It's nice. It is, you know, it really does. You know, that's interesting. There's a difference in the air, and it's not bad. So,
thank you. Well, I really appreciate your taking time to talk with us today, and I really hope you enjoy the rest of the time here at BL.
Well, thank you very much. I'm sorry we have to go back to San Francisco tomorrow morning, but unfortunately I don't have any relatives left in the Midwest except one aunt who will be 101 in 2 weeks. And she's doing great. My dad's younger sister.
That's amazing. Great. Thank you so much.